You're listening to Lucid Cafe. I'm your host, Wendy Halley. Can I just tell you how nice it is to not have to wear a mask all the time? Mighty strange times. Unlike COVID, the subject of today's episode has not gotten the attention it needs, particularly from the medical community. I've heard way too many heartbreaking stories from people who've found their way to my wellness center over the last 7 years about how their serious, sometimes physically, emotionally, and mentally crippling bouts with Lyme disease were ignored, misdiagnosed, ridiculed by their physicians and specialists. Well, the good news is that Lyme disease is finally being taken more seriously. I suspect in part due to doctors like my guest, Dan Kinderlehrer. Dan is a nationally recognized physician with expertise in the fields of nutrition, allergy, environmental medicine, Lyme disease, and the healing of mind, body, spirit as a unified whole. He co-founded the New England Center for Holistic Medicine in Newbury, Massachusetts, and has taught extensively, including practitioner training courses at the Omega Institute, the National Institute of Behavioral Medicine, and the International Lyme and Associated Diseases Society. He created and organized the Lyme Fundamentals course, which is presented annually at the International Lyme and Associated Diseases conferences. He's the author of several review articles in medical journals and the Lyme Times. His integrated medical practice in Denver, Colorado, focuses on the diagnosis and treatment of tick-borne disease. In today's episode, we talk about Dan's new book, Recovery from Lyme Disease, the Integrative Medicine Guide to Diagnosing and Treating Tick-Borne Illness. Well, I hope this conversation is as informative and helpful to you as it was to me. Please enjoy my conversation with Dr. Dan Kinderlehrer. Dan, thanks so much for coming on the show. I really appreciate it.
Thanks for having me. I'm looking forward to this.
Yeah, so you have a book out that's called Recovery from Lyme Disease, the Integrative Medicine Guide to Diagnosing and Treating Tick-Borne Illness. As I mentioned before we started recording, I'm in Vermont, and it's a big part of what I see in the clientele that come here to my wellness center. A lot of folks struggling with Lyme disease, and then a bunch of other infections and diagnoses, a complex of things. And I think this would be a really helpful conversation for my listeners, or my one listener, whoever's out there. I don't know. I think it would be helpful to kind of get an idea of the history of Lyme disease, because I think it has kind of a tortured history. And I'd be curious to hear about, do you know how Lyme disease even came to be? Like, where did it come from?
Well, all life came from the ocean, so I imagine the genesis is there. I don't know specifically how bacteria have evolved, but I can tell you that, do you remember the 5,000-year-old man that was dug up a decade or more ago? He was somewhere in the Austrian-Italian or Swiss and Italian Alps, but he was preserved. I mean, that was what was cool about it. He was this dude was preserved, and they happened to find some foreign DNA when they were doing whatever evaluation they were doing. And when they typed this DNA, he had Lyme bacteria.
Really?
Yeah. So we know that it's been around a long time. And we know that around the 1700s, there was an island called, are you ready for this? Deer Island. This is off the coast of Great Britain, where people were getting these syndromes with neurological and musculoskeletal complaints. And there was I'm not sure if it was a doctor or it was a spiritual leader who said this is connected to the bite of these little wiggly things with multiple arms. and rashes. My point is that Lyme disease has been around a long time. The Lyme disease, as we know it, was described by a Swedish physician around the turn of last century, and he connected this bullseye rash with a tick attachment and arthritic symptoms. In the European literature, there's a lot of reports of this over last century, and they determined also that it not only caused musculoskeletal and neurological complaints, but it also generally responded to penicillin. All this has been known. And then in 1971, there was a dermatologist in Wisconsin who saw a patient with a bullseye rash and a tick attachment who was acquainted with the European literature and said, this person has what they're describing, and treated it and with penicillin, and the dude was fine. Then there was an outbreak of kids diagnosed with juvenile rheumatoid arthritis in Lyme, Connecticut. Now, that autoimmune condition is not very common, and suddenly you have multiple kids on a block being diagnosed with it. And some mothers really worked hard to get the attention of the CDC, but they finally did. And then a crew was sent out, particularly led by a rheumatologist at Yale, where, because he was a rheumatologist, he focused on the arthritis and sort of ignored most of the neurological complaints. Did connect it with the rash and did connect it with the tick, but also got things wrong. He thought this was a virus. He thought it should be treated with corticosteroids. That was Alan Steer. And then they continued to get things wrong after that. The rest is history. Basically, it was determined this is a bacteria and it causes an infection. But there continues to be a lot of dispute on this infection. There's two schools of thought, and we refer to this as the Lyme Wars. There's one school of thought, the Infectious Disease Society of America, who say Lyme disease is easily diagnosed, easily treated, short course of antibiotics, you're done. If you're still sick after that, something else. And then there's doctors like myself who say, actually, not so easily diagnosed, not so easily treated, frequently complicated by co-infections, which are other microbial infections you can get from the very same tick attachment, and it can take long-term treatment. Right there is the controversy and the Lyme Wars. And they, of course, the idea say they're wrong. And the whole third chapter of my book which is entitled Anatomy of the Lyme Wars, just goes through, here's all the evidence basis. They don't have it. We do. I mean, it's well documented. But just to give you an idea of the scope of the problem, in 2017, the CDC said there were 40,000 new cases of Lyme that were recorded. And understand that doctors are being asked to do that when they see a new case of Lyme disease, but most doctors don't. And through their own algorithm, the CDC determined that we think we're only hearing about 1 in 10 cases. So they said there's about 400,000 cases of new Lyme. Okay. Their criteria are so strict that they only actually get 1 in 5 new cases. Okay. In other words, for every case that meets that criteria, there's like 4 others that don't meet that criteria, but still have Lyme disease. So now you can multiply that by 4 or 5, and we have well over 1 million new cases of Lyme disease a year. And it's generally accepted now that 10 to 20% of these people go on to have chronic symptomatology. We're talking about hundreds of thousands of people every year. And this doesn't even include all the people who got Lyme disease and didn't know it, never saw a doctor. This is a big, big problem. So that's where we are today.
Well, I have to say I'm a little shocked to hear that it's been around for as long as you're saying it's been around. I guess it may be because it's becoming something that people are actually acknowledging and talking about in our culture. And I guess that falsely gave me the impression that it's a newer infection.
Well, when the CDC and the rheumatology department at Yale came in and said, "Oh, we discovered Lyme disease," they totally ignored the European literature we discovered a long time ago.
Is it worldwide, or is it just specific to certain continents, or do you not know?
Oh no, we now have Voyager on Mars, and they found it there. I'm just kidding you. No,
Well
no,
played, sir.
this is international. There are big outbreaks in parts of Europe and parts of Asia. I don't know what it's like in Africa. I don't know if they're looking for it there. We do see it much more in warmer climates. People think you have to be in, New England or Connecticut to get this. It turns out that there are areas of the United States that are highly endemic. New England, where you live, is one of them. But the Great Lakes states, which is where it was first found in the United States, is another one, highly endemic. The Northwest is highly endemic. These are moist, more humid states. The Southeast has a lot of it too, but the doctors simply aren't diagnosing it. I just had a patient this week with recent Lyme. I only see a handful of people who with acute or recent Lyme infection every year. And this one had 4 tick attachments when she was in Florida 6 weeks ago. She developed many symptoms, and she saw her primary care doctor here in Denver, who said, well, there's no Lyme disease in Florida, so you don't have that, and didn't recommend any treatment. That's terrible, but it happens all the time. Not only is there a lot of Lyme disease in Florida, but Lyme disease has been reported in all 50 states. You cannot exclude it on the basis of geography. The Department of Health in Colorado still claims there's no Lyme disease here, but wow, I hope a whole lot of patients who got Lyme disease here in Colorado, and veterinarians in Colorado say, oh yeah, we see it in the dogs regularly. Somehow the ticks do get across the border. So it's a big problem. It's all over, and it is international. Yeah.
Do you have any theories as to why the medical world has had such a tough time acknowledging that Lyme is a real thing?
It was so weird to me when I first confronted this situation. And in 2001, I was in the office of Dr. Sam Donta. Sam was an infectious disease physician, university-based, Boston University. I was in his office, a university hospital, and on his desk was the recent New England Journal of Medicine. It had 3 articles on Lyme disease, which of course I had read. And I said to him, how does this flawed stuff get published? Because it really was flawed stuff. How does it get published? And he said, Dan, never before in my medical experience have I witnessed where so few people had so much influence and were so wrong. So some people got it wrong in the beginning. I mentioned that that Steer thought it was a virus infection, treat it with steroids. I mean, totally wrong. But also there are conflicts with insurance companies and patents on testing kits. I mean, there's a lot of stuff that not so kosher, and they refuse to admit they got it wrong. And they have a lot of influence, so that most doctors don't think Lyme disease is real. It's very sad. It's awful. I mean, I think the vast majority of people don't ever get diagnosed and treated.
I'm going to say something a little controversial, but I'm actually surprised that the allopathic healthcare industry hasn't embraced it, because I could see there'd be a lot of money in it, right? That if it's so widespread, that they would be making a lot of money.
Well, I'm going to give you the flip side of that.
Okay.
The pharmaceutical industry doesn't want to cure anything. They want to come up with medications you're just going to take the rest of your life. Right now, the biggest moneymaker for big farm are biologicals. You have some sort of autoimmune problem, you need to take Humatin for the rest of your life. That kind of thing. Okay, they're not interested in curing anything.
Right. I'm not surprised by that. Yeah.
And big farm, they finance an awful lot of the research on this stuff. It's been very hard to get research done on Lyme. Big Farm doesn't want to come up with bigger and better antibiotics to treat it because they don't want to cure it. Meanwhile, these people continue to be active patients. They're just labeled with chronic fatigue syndrome, fibromyalgia, autoimmune, whatever. They're sent to psychiatrists. I'd love to talk to you about I know that's your field, and talked about the neuropsychiatric issues associated with this because they're huge. So it's not like these people don't continue to be part of the healthcare system.
Yeah, I guess I didn't think that through. You're right. I mean, they're just not calling it Lyme. The patients are seeing them for their other presenting issues. So then that suggests Lyme is treatable.
Oh, absolutely.
Okay, so before we get into that, how might someone know if they have Lyme or suspect that they have Lyme?
Okay, so I'm going to talk about Lyme in its chronic stage, not in its recent stage or acute stage. Once someone has had this infection and it's been ongoing for at least months, the most common symptoms are fatigue, sleep problems, cognitive issues, brain fog, trouble with concentration, attention, short-term memory, mood issues, often anxiety, depression, irritability, and muscle aches and joint pains, sometimes neuropathic pains. These are the most common symptoms associated with the chronic infection. I could make a list that's 10 times as long as that, but those would be the most common. Okay. And typically those patients get seen by their primary doctor. And like I said, they may be misdiagnosed with chronic fatigue syndrome, fibromyalgia, or they're told, well, you're depressed. You need to see a psychiatrist, at which point no one listens to any of their somatic symptoms. So that's where it starts. That's how someone should start thinking, well, wait a minute. There's something else going on, something else real. Most of my patients I think of as heroes because they're not willing to accept the ignorance of their own doctors, which can be quite traumatic because the doctors are in such denial. I mean, I could tell you story after story, just terrible medicine. But that's what people should be looking at. In terms of acute Lyme, which is recent, maybe only about 15% of people see the tick attachment. These ticks are about 2 millimeters. They're really small. When you get to our age, you're probably not going to see them. They also like to go to warm, moist spots, so they can be in your armpit, in your groin, between your buttocks, on your scalp, or anywhere else on your body, but often missed. And so most of the time we don't see the tick attachment. The rash occurs in up to half of people, but maybe less, and the bullseye rash in less than half of those. So it could be a non-specific, oblong, salmon-shaped rash, and often you don't see any rash. And some people don't get the flu syndrome, which can occur within a week of the rash. In other words, if any of those things happen, you should get checked, but it's often missed, and then people go on and develop chronic illness.
Does everyone who is infected develop symptoms?
Good question. No. If it's Lyme by itself, that is, there's a tick attachment and the Lyme bacteria is injected and no other co-infection, so it's only Lyme, then many people, and I don't know how many, are asymptomatic or really minor symptoms, and that's it. Their immune system takes care of it. There are a lot of people walking around who have Lyme bacteria who are not sick from it.
And do you have any thoughts on why some people would get very sick versus the people who wouldn't?
Yeah, I should have mentioned in response to your previous question, those people who are carrying the Lyme bacteria but don't get sick, they might get sick later on, particularly if they encounter some sort of stress, whether that stress is a trauma, or particularly head trauma or surgery, or the loss of a parent or a divorce, or, any kind of stress, or they're given a course of corticosteroids for poison ivy, which suppresses the immune system, and now suddenly they have this fulminant infection, okay? So my point is that even if they're asymptomatic, they are prone to possibly becoming ill with this months to years later.
So this stays in your system then?
Yeah.
It burrows in your tissue or cells?
It hangs out, they typically exist in something called biofilm communities, which we can talk about if you wish. But, we have trillions of microbes in our body, and a healthy immune system can keep it under check. But in some cases, not. And that, in answer to your second question, the biggest issue of whether people get really sick from it is, I'm going to call it two issues. One is the bacteria itself. There's a lot of different varieties, like we're seeing different variations on the COVID virus, right? It's all SARS-CoV-2, but we're seeing variants, and we're going to see plenty more. Well, there's tons of variants on Borrelia burgdorferi, the bacteria that causes Lyme disease. And some are a lot more virulent than others. Some are pretty minor and don't like to go past the skin. So that's one big issue. The second big issue, though, is the co-infections. The co-infections are generally worse than Lyme. They don't get much attention or respect, right? But they're much worse. And when you add co-infections, you got two or more infections, that further suppresses the immune system. The illness is more severe, and it's much harder to treat. I have patients who have 4 or 5 infections from a tick attachment.
Does that mean that if your immune system is already compromised, if you already have weaknesses in your system, will it bring those weaknesses to the surface and make you exhibit whatever that, if it's an autoimmune related thing or anything else you might have going on?
Yeah, and you're talking like seed versus soil now, right?
Yes.
So this goes back to Pasteur. He more or less was the father of the germ theory. But at the same time, there was another school of thought, Beauchamp, another Frenchman, who said it's the condition of the host that determines whether you're going to get sick or not. And this is very interesting. Back then, tuberculosis was fairly rampant, but some people got really sick from it and some people didn't. And in this apocryphal story, Pasteur went to the French Science Academy and brought 2 birds with him. One bird was live and clucking, the other one was dead. And he said, listen, I injected both of them with anthrax. This one, it was kept warm and fed well, and this one was kept cold and fed not so well. And he said, it's not the germ, it's la terrain. I can't speak French, obviously. So
well done, though.
Thank you. And the thing is, it's both. It really is both of these. It's the germ and it's the terrain. So as you're suggesting, how we come to this has a lot to do with the virulence and the severity of the infection. For example, if you have immune suppression for any number of reasons, because of previous infections or because of adverse childhood experiences, right? I mean, if we've been traumatized, there are all sorts of reasons why. It could be nutritional issues. It could be that we're exposed to lead and mercury or mold toxins. All different environmental issues can impact our immune system, or for genetic reasons, we're more prone to autoimmune problems, and then we'll tend to have more inflammatory responses. I'm going to digress with just a story that occurs to me. I don't think you would have heard about it in Vermont, although maybe you did. It was on the national news. Up in Fort Collins, Colorado, there was a guy running. This was, I'm going to guess, about a year ago. and he gets attacked by a mountain lion. Okay. Well, what does he do? He strangles the mountain lion to death. I mean, amazing, right?
I remember hearing about that. Yeah. Because I was thinking like, wow, that takes some balls.
Really?
But if you're in survival mode, you'll do whatever.
Really?
I guess.
And I was thinking, and I saw an interview with him, and he said, well, like he hears some clip clopping behind him, and then suddenly, ka-chung, and he said, so he remembers that when he played with cats when he was a kid, once they were on their back, they sort of like couldn't get their footing and so on. So, he got the claws off his face and got the thing on his back and then strangled it to death. And I was just thinking about the inner belief systems of someone who could respond like that. This is not someone who was exposed to significant trauma when he was a child that would affect their belief in themselves and their ability to respond to threats in their environment. This is someone who felt like, okay, I'll just do what I have to do to survive here. But think about someone who grew up in a challenging home environment, who couldn't protect themselves, who were not in control in their environment, who never believed they would be in control in their environment, and they get attacked by a mountain lion. I don't think they're going to be end up on the positive side of that encounter. So I think, our belief systems about who we are in the world have a lot to do with our immune system. So I'm going to take this a little piece further because I think you'll be interested. In a previous incarnation, before I was a Lyme doc, I did a ton of environmental medicine. And that was a lot of what I did in the scope of integrative medicine. So I saw tons of people with food sensitivities and stuff like that. Now, going back 30 years, okay, I was in Massachusetts, and I think I saw the sickest environmentally ill people in northern New England. I mean, they came from all over. We had a big environmental medicine practice. And so I was seeing people not only with tons of food allergies, I was seeing people who had serious chemical sensitivities. I saw people who would live in the woods, and if someone with perfume walked within a mile of their log cabin, they would have an asthma attack. Super sensitive, environmentally ill people. So, I mean, that one wasn't extreme, but people who are allergic to lots of foods were eating only like 3 to 5 different items and having to be super careful. You couldn't go out in public because of all the different chemical smells that would trigger them. Back then, the vast majority of those patients had seriously traumatic childhoods. And it was something I noticed, and other docs noticed this as well. And it's very interesting. What's his name? What's the doc who wrote Your Body Knows the Score?
Bessel
van der Kolk. Thank you.
Yes.
So I never knew van der Kolk. I actually knew his family, but I heard him speak, and he was saying that, these people, because he's dealing with trauma victims, right? He said they have really significant physical problems, right? And I was seeing people with significant problems who had significant histories of childhood trauma. We're seeing the same population. We were just entering it from the different sides. But I want to bring this back to, what is the immune system? The immune system is all about boundary protection. So think about that. A healthy immune system does 3 things. First, it discriminates self and non-self, right? So here, this cell is Dan Kinderlehrer, that cell is Wendy Halley, and here's a wheat, and here's a pollen, and here's some dust, and that's not us. Okay, next is it discriminates, is the non-self a threat? Is this going to hurt me, or is it not going to hurt me? And a well-balanced immune system doesn't get upset when something benign crosses its path. But if it is something that's a threat, a virus, for example, or bacteria, then a healthy immune system successfully eliminates it, does it in an efficient fashion. Okay, that's your healthy immune system. But let's say there's a person who grew up without a chance to develop healthy boundaries because their space was invaded. It was invaded and they didn't have control over it. Not only that, people who were supposed to be safe were not safe. So there's a failure of ability to discriminate what's okay, what's not okay. Our immune system manifests in our body mind. And so in this, what happens is while an individual who's been traumatized becomes hypervigilant, these are people who can tell by the way the door closed whether their father is coming home drunk or not, right? They're sensing hypervigilance, but they become hypervigilant to their environment. They become reactive to foods. They become reactive to chemicals. What's safe? What's not safe? I got to react. So, there's this connection, mind-body connection. I don't even like to use the word connection because the mind and body are not really separate, right?
Right.
For mind-body wholeness, it's all one universe, just manifesting on different levels of beingness. And so what I'm saying is that this experiences that manifest in belief systems are also manifesting in the body with immune reactivity, the same thing.
The tradition I study shamanically is based in Hawaii. And one of the tenets of the philosophy, this ancient philosophy, is very simple. It is the world is what you think it is. So it's all about belief, right? That's kind of the genesis of everything else. So you're speaking to the things that I've discovered since I opened this wellness center and how intricately tied together emotional well-being, in particular a trauma history, and physical ailments are. It's like they're bedmates. You can't really separate them, it seems.
Yeah. I as you know, I mentioned before we started recording that I studied Kabbalah and Kabbalistic healing, and what you just described is very Kabbalistic. That in the Kabbalistic cosmology of the universe, it is started with everything. Just God is everything. There's nothing exists but the divine essence, fulminant, whatever language we can use that doesn't adequately describe that. And then the next thing that happens is the idea of something other than God, which of course is sort of a paradox because it's still God. It's just an idea that there could be something different. That's the universe of Bria or creation. And it's pre-energy, it's pre-matter, it's belief systems. And it's the belief systems that then hold the template for our emotional and energy bodies, which then hold the template for our physical bodies. Okay? It's all one manifesting on these different levels, but they're all here at the same time.
Exactly. And I think that's what epigenetics is suggesting as well, right? That your environment kind of dictates the expression of your genes.
Yes. So, epigenetics, I think, is a big deal, like so many other things. Just so the listeners understand, genetics, we understand genetics changing as, in terms of natural selection and natural evolution over millennia. But their epigenetics refers to changes that can occur from one generation to the next. And what's changing are proteins that sit on top of genes that can turn them on and off. So depending on if you've been exposed to Roundup, or if you've been traumatized, or if you've been obese or had some other disease, you can pass that on directly to your offspring. And I actually think that we are suffering from an accumulation of genetic stressors that has been more and more of a burden to successive generations. And that's why we're seeing illnesses. Why are we seeing so much autism? We're seeing epidemics of a lot of things, not just Lyme disease. That includes obesity, includes adult onset diabetes, heart disease, some cancers. mental illness. Oh my God. I actually think that people are sicker. They're really much sicker than they used to be. Doctors like myself who treat people who've fallen through the cracks. So we're seeing people sicker than we used to see. And I think it's because an accumulation of epigenetic stressors that just get passed on and accumulate generation to generation. So newborns are not born with a clean slate, very sadly. And when I talk about the epigenetic stressors, I'm talking about changes in diet, the nutrient depletion. I'm talking about the hundreds of thousands of chemicals that humankind has never been exposed to before. But I'm also talking about those stresses that we were referring to before. Here's something, I don't know if you've thought about this or not, Wendy, but we're told, and I hope it's true, that there's less childhood and sexual abuse of children than there used to be. Hopefully that's true. But there was something different going back 100 years, which was that families lived in extended communities and had relatives nearby. And if it wasn't safe in that home, the kid more often than not had grandparents who were safe, aunts and uncles and cousins who were safe. That doesn't happen anymore. It actually changed, particularly in the Reagan years. That's something else. But we don't have the safety that we used to have when we lived in extended families and communities. So that even if the abuse was horrible, when it occurred there was some place we could go that was safe, much more so than nowadays. And in fact, our old friend Bessel van der Kolk, one of the things he said in a lecture was the single biggest determinant of how well people can heal from that trauma was there at least one safe person? Because they had an experience of safety that they can re-access in the healing process. But if they've never felt that safety, it is much more challenging to heal.
I'm going to throw in, because what's sparking for me as we're talking about this is this conclusion that I kind of came to through my practice and my experiences in the dream time, is that it seemed like I would go back even further in time, back to the time when we told ourselves, most likely in continental Europe, we told ourselves the fiction that we're separate from nature. And then all of these things came from that. Colonialism or colonial mind kind of put us up into our intellect. And so we used our intellect to try to navigate through the world. And then the disconnect just got bigger and bigger and bigger over time. And we've gotten farther and farther away from the natural world, thinking that we are not nature, that humans are not a part of the natural world in a strange sort of way, that the natural world is there at our disposal to use rather than to be in relationship with. And tying with the people I work with, the folks who have severe trauma in particular, one of the things that they report most when they say they didn't have a safe person when they were kids is that the natural world is what provided their safety. So they would spend all their time out in nature. Of course, I'm in New England, in Vermont, and nature abounds. So a lot of the folks locally were fortunate to be able to experience nature. But if you lived in a city, I don't know how that went for people who are traumatized, but that's looking at this issue in maybe a deeper way than we need to go. And maybe you disagree with it, I don't know, but that's kind of what I've concluded is more of a bigger issue that we're dealing with.
Our separation from nature.
Yes.
And I think also our separation from each other.
Yes,
that
yes.
We've lost sight of our interdependence, and all we have to do is stay at home and click on Amazon to get whatever we need. Live in big houses with tons of acres, and we just don't need anybody else, except, of course, that's a fallacy. Of course we need people, but...
Yeah, we didn't used to live, I mean, we lived in more tribal community back then. So there were probably safe people in a community that you could connect with, predating the time of the extended family that you were referring to. Yeah, so you're absolutely right. That idea of being in relationship with the people around you and the natural world, the connection.
Yeah, I think it's very sad that in general we've lost the concept of mutual interdependence. Because if we did, we would be treating each other much better than we do.
Yeah, absolutely. Well, I don't want to go too off topic. I want to get back to Lyme disease, but in the time we have remaining, I'd love to switch gears a little bit. What have you discovered about the best way to treat Lyme?
First of all, I don't feel like I've personally discovered anything. I sit on the shoulders of many, many other people, and I've managed to assemble that into a book that thankfully has gotten very good reviews and hopefully will help a lot of people. When people ask me, how do I treat Lyme disease? I say, I don't. I treat people. They're all different. And that's the most important thing here. There's no one recipe. You got to treat the whole person, and that's going to be different for everybody that comes through my door. A very small vignette. I was having dinner a while back with neighbors, so they're both doctors. And one of them's an emergency room doctor, one's an immunologist. So we're sitting at the dinner table. I'm just making conversation. I say, how was your day at the office? And they both said, boring, same old patients. And I thought, wow, I don't have any boring patients.
How sad, yeah.
Yeah, they're all really interesting. They're fascinating. They're all challenged. We have to do medical detective work on each one of them, which I enjoy. What's going on here, And so I don't have a nice, easy answer for you. That's why the book is 400 pages.
Right. But I think one of the important things that you illustrate in your book is the holistic nature of the treatment plan.
Mm-hmm.
It would be different for each person. I get that. But that you're not treating just one thing. Like you're not just treating the bacterial infection. You're treating hormones if necessary. You're treating, well, I don't know if you're addressing the mental health components. I mean, you're looking at all kinds of things.
Mm-hmm.
Are you looking at diet and?
Yeah, all of the above. You're right. An initial intake in my office is about 3 hours. And, we start with, tell me about your childhood. And then we just take it up chronologically from there. And I'm always looking for patterns of insults, patterns of symptoms, exposures, things like that. I want to put it all together and say, well, here's where I think imbalances are and what we need to do to help get you imbalanced. We should do some tests that look at your adrenals and your thyroid, as well as, are you digesting properly? Do you have food sensitivities? There's always things going on. It's very interesting to me that I only see a handful of acute Lyme per year. I mean, 99% of my practice is people have been sick for years. But of the people I see who do have acute or recent infection, when I take this long history, it turns out that about a third of them have a chronic infection that they didn't know. So like in the past month, there was a woman, she's probably around 60 years old, and she was just bit. I mean, she had a tick bite and a rash. I mean, there was no question what happened. We're looking back, and she's had these mood issues really since she was a teenager. And guess what? Oh, she does remember now an insect bite. And then she remembers this skin issue that actually is diagnostic of one of the co-infections. And then, she's been dealing with these quote unquote mental health issues all her life, seeing them as mental health issues. And I'm saying, well, actually, I think, you've been infected since you were a teenager, and that's really affected your issues with anxiety and depression. I did a study. It was just published a month or two ago. And I'm going to tell you what preceded this study. I had a patient, 16 years old, diagnosed with Anorexia Nervosa. And she went from inpatient to outpatient, inpatient to outpatient. eating disorder clinic. She refused to eat. She had a nasogastric tube, and she really fit all the criteria for anorexia nervosa. She had been purging and so on. And she had suicidal intent. Her mother was a nurse and pretty savvy, and they had lived in upstate New York, which is another hot spot for Lyme. She got her tested. She had Lyme disease. So they brought her in to see me. And we diagnosed her with 4 tick-borne infections. And one of those infections, Bartonella, which can cause a lot of neuropsychiatric problems. Bartonella can cause a skin rash that looks like stretch marks. It'll cause red lines, red violaceous lines. They're not in the normal skin planes of stretch marks, right? People particularly get them on the hips and thighs, but they can occur anywhere. And she had stretch marks on her breasts, on her thighs. I don't remember where else. And she thought that this was more evidence that she needed to lose weight.
Oh.
That she had Bartonella stria, not stretch marks. Okay.
Poor thing.
But the good news is she got better. I mean, we treated her with IV, intravenous, and oral antibiotics for a year. She's had no eating disorder, and it's been at least 3 years since then. Okay. So I said to a colleague of mine who was training with me, I said, hey, wouldn't it be good if we could go into an eating disorder clinic and just test everyone for this? And she said, well, I'm the medical director at this residential treatment center for adolescents. So we approached them. And these kids, all of whom are diagnosed with DSM-5, major depressive disorder. Most of them have generalized anxiety disorder. Several have other labels, and several of them have made suicide attempts. Basically, they were severe enough that they couldn't hack it at home. They couldn't conceive of going to public school. And they're at this residential facility. And we test 10 of them at random. And depending on how you interpret the test, 6 of them had evidence of tick-borne infections. And maybe if you broaden your interpretation of the test, up to 9 had evidence of tick-borne infections. But we also did something called the Cunningham Panel. The Cunningham Panel looks at antineuronal antibodies, which are an index of brain inflammation that can cause all sorts of mental health symptoms. It causes the syndromes we know as PANDAS and PANS, if you're acquainted with that. These are infections that result in severe OCD, eating disorders, a lot of mood and behavioral issues after infections. 9 out of 10 of these kids had antineuronal antibodies.
Wow.
Really, really. These kids had brain on fire. And that's why they were so depressed. They were so anxious. They had so panic attacks. That's why they were suicidal. They had brains on fire. They had all sorts of neuroinflammation. So Susan Sweeto at the National Institute of Health back in 1994, she described kids who had strep infections and went from being normal kids to suddenly developing severe OCD and anxiety disorders. Lots of more studies got published. It turned out it wasn't only strep, but that also some of the tick-borne infections and viruses, including Epstein-Barr, including mold, can trigger the same syndrome, and it can cause anorexia nervosa, the same syndrome. And what it is it's autoimmune inflammation in the brain. So I just want to describe what I mean by that. If you get a strep throat and antibodies to strep then attack your heart valve, that's rheumatic fever. And the reason antibodies attack your heart valve is because there's some structural similarity between the cells in your heart valve and the strep bacteria. You can say that these antibodies get confused. Well, it's an autoimmune issue because your immune system is attacking your own tissue, but it's also an infection. And that's what we're talking about with these syndromes, in which the kids develop what is in fact autoimmune encephalitis, because these microbes are triggering the formation of antibodies that then are attacking the brain and causing all sorts of mood and behavioral disturbances. And even though this is best described in kids, it happens in adults too. It's it's unfortunate nomenclature. I actually wrote a paper that said we should change the name. It's now called PANS, Pediatric Acute Onset Neuropsychiatric Syndrome. We should change it to Microbe-Induced Autoimmune Neuropsychiatric Syndrome, or MANS, because it's not just kids and it's not just acute onset either.
Yeah, that's what I was just going to ask. Do you see that with adults too? Because I'm seeing that in my client base. I've had clients on the edge of psychosis.
Yes.
With recent Lyme diagnoses. So that makes me wonder. So we talked about a history of trauma. Are you suggesting that people who are developing these severe mental health issues, that it's a byproduct or because of the bacterial infection, the Lyme infection?
Yes.
And not necessarily attributed to a background, like you could have somebody who didn't have a huge history of trauma and they develop these really severe mental health disorders.
That's right. So I will say that there's genetics involved and probably epigenetics.
Okay.
Because what we're talking about is not invasion of the microbe. We're talking about our body's response to that microbe.
Ah, okay.
And because of genetics and possibly epigenetics, some of us are going to be more reactive to those microbes than others.
So is the goal really to calm the nervous system down so that the body can heal itself? Is that the idea?
Yeah. Yes. So this is actually a very important point. These infections, the tick-borne infections, they generally don't cause invasion the way we normally think of infections. A strep throat wound infection, you're talking about the bugs invading tissue, disrupting the cells, and then you have a local inflammatory response to kill the bugs and repair the tissue. That's not what happens with these. What happens is, instead of hitting hardware, the cells, they hit software. They disrupt our regulatory systems. They disrupt the immune system, the nervous system, the endocrine system, and then it can eventually disrupt end organ function as well. But it's the regulatory systems that go awry. So you see all these nervous system complaints. You see a lot of inflammation, because this is something that people are more aware now because of COVID, because that's what happens in the second stage of COVID. It goes from a local upper respiratory infection to, like, boom. The pneumonia is not the way we normally think of a pneumonia. It's more like a hypersensitivity pneumonitis. And, it can cause devastating effects all over the body, but we think mainly not by invasion of the virus, but by the severe inflammation. Now the term cytokine cascade is part of the natural parlance, right? I mean, we Lyme docs have talked about cytokine cascade for decades. Now we're talking about an immune response. The cytokines are the immune messengers. And then, wow, we're talking about hyperinflammation. Hyperinflammation is the problem. So yes, you said calm the nervous system. We're actually talking about calming the immune system and the nervous system, which aren't separate systems at all, right? We cut them up so people can be smart in one area and not in next. We cut them up so that we can sort of understand them from a functional basis. They are not separate. It is one integrated whole, all working together, all communicating with each other at the same time. It was Candace. What was Candace's last name? She wrote a book called Molecules of Emotion, right?
Yeah.
Yeah.
I can't remember her last name.
It'll come to us. So Candace, she is the one described that there are receptors on all the cells for these neurotransmitters. The nerves aren't just talking to nerves. They're talking to all the cells in the body. And the same is true whether we're talking about these cytokine messengers in the immune system, or we're talking about hormones. They're all of it is talking to each other all the time. We basically are a vast communication network. And this vast communication network has gotten alarmed and is going nuts with these infections.
Wow. I mean, that would make sense why I'm seeing such great results with people who have Lyme disease and co-infections when they get in my healing chamber here at the Wellness Center, which is basically just surrounding them with light and sound frequencies in a large enclosed space that's made of wood, so it resonates like a musical instrument. And then your body drops down into relaxation pretty quickly, and then the little bit of research that's been done on it has shown that the body starts going into self-healing mode, just basically because you're so deeply, deeply relaxed that all that stress and tension that you're holding releases so that your body can start doing this stuff. And usually inflammation is the first thing that your body starts to want to do in here, is to reduce it. So people start feeling temporary pains in joints, and then it goes away. And then when they get out, they feel like they can move better and have a reduction in pain. I was really, really pleased to see that now that I've gotten to know you a little bit better, and I'm not surprised to see that you have this whole section in your book on alternative treatment options that are out there for people with Lyme.
It sounds like in what you do, you're maybe among other things, you're inducing a profound parasympathetic state.
Exactly.
So, for your listeners, the autonomic nervous system is that part of our nervous system works automatically. We don't think about when we should breathe, how fast our heart should beat, or maintain our blood pressure, or where we should send blood flow. And there's two arms to the autonomic nervous system. There's the sympathetic and the parasympathetic. And for the most part, sympathetic is stimulatory, and for the most part, parasympathetic is inhibitory. And the whole point of a healthy autonomic nervous system is to keep you in homeostasis. But with this inflammatory reaction, people develop dysautonomia. The autonomic nervous system goes in chaos, and that's where people see all sorts of fluctuations in their pulse and blood pressure, but it can cause a whole lot of other issues, from pain syndromes and migraines to diarrhea and anxiety and so on. But the parasympathetic system, as you're describing it, is very healing. And for some of us, especially with experiences of trauma or just the inflammation itself, have trouble relaxing into that. And what you're doing is helping induce it. And it's a profoundly healing state. And so that, the bugs can still be there, but if we're not getting alarmed by them, it can lead to healing. If someone's got multiple food allergies, okay, they can feel better avoiding foods. But if their bodies aren't getting triggered by them, that's a much deeper healing. And so the bottom line is, when we're treating people with chronic Lyme, which is really, I call it really Lyme disease complex, because Lyme is not the only bacteria. They always have co-infections, and they have these downstream issues that we've sort of alluded to. The issue is not we're going to get rid of these bugs. I mean, hopefully we do, but we never know. We don't really have tests that say whether they're gone or not. But hopefully induce a state where your body's not getting triggered by them anymore.
Right. Well said. Well, this has been incredibly helpful, this conversation. Are you taking patients these days? Are you accepting new patients?
Yes, and there's a caveat, which is I have a long waiting list.
Okay. I suspect that people listening will want to know, given your expertise. Is there a way for people to get a hold of you? Is there a good way if they wanted to try to get on your waiting list?
Sure. They can call my office number, which is 303-444-4877. If they want to know more about me, I actually haven't had a website. I really didn't want a website. I mean, I always had plenty of patients, and I just didn't want to deal with it. But now that the book is out, I have a website called recoveryfromlyme.com. So people, if they want, they can learn about me. A lot of podcasts like this one, I assume will be on there. Links to podcasts, a lot of reviews on the book, and links to, I think, some chapters in the book. And also you can contact me through that website.
So I will put all of that information in the show notes as well, so people can access it. Dan, this has been great. Thank you so much for coming on the show. I really appreciate it.
You're welcome. This was fun.
I think we need to figure out a way to clone Dan. But I guess until that happens, we can get his book, which is full of all kinds of sensible, helpful information about Lyme, and can be found on his website, recoveryfromlyme.com. Thank you for listening. I'll be back in a few weeks with the final episode of Season 3. Until next time.